A new strain of potentially deadly superbug has broken out in the Flinders Medical Centre.
Sounding the alarm about nightmare superbugs in our hospitals, now in 42 states, highly contagious, deadly, and drug-resistant.
Antibiotic resistance happens when bacteria change to protect themselves from an antibiotic. They are then no longer sensitive to that antibiotic, and when this happens, antibiotics that previously would have killed the bacteria or stopped them from multiplying and no longer work. This is currently a global issue that affects many people. Superbugs. They are various strains of infection that cause bacteria to become resistant to antibiotics. In early 1930s, before the creation of antibiotics, doctors had a small amount of drugs to select from to relieve the symptoms of patients, and these were ineffective for bacterial infections. There was a breakthrough in the 1930s where sulfonamides were the first antibiotics. Penicillin was a major step in the medical industry as it was capable of treating what was once a severe disease. During the late 1940s, bacteria developed more and more. Stronger antibiotics were made as penicillin wasn't responding to some infections. A strain of staph known as MRSA, methicillin-resistant Staphylococcus aureus, and this is a serious health problem today.
After the superbug outbreak, many patients have come into my clinic asking what the superbug is all about. Bacteria carries genes that allows them to survive exposure to antibiotics we currently have. This means that infections caused by these bacteria are harder to treat, although they are not necessarily more severe or infectious. What is concerning is that the gene that carries antibiotic resistance that can be passed between bacteria, allowing for the creation of bacteria to carry resistance. According to some studies, the CDC says that approximately 40 to 50% of those infected may die. So, what is the symptoms of a superbug? These include high temperatures of above 38 degrees, chills, feeling unwell, dizziness, confusion, muscle aches and pains, swelling and tenderness in the affected body part.
The rise of antibiotics resistance has become an increasing concern for scientists around the world. The resistance developed over time is due to doctors unnecessarily prescribing antibiotics and patients not completing the correct dose. The more antibiotics used, the more chance of bacteria becoming resistant to them. There are many superbugs which have evolved and currently existing, and just to name a few, methicillin-resistant Staphylococcus aureus, one of the more common bacteria which does not respond to methicillin antibiotics no longer. Tuberculosis, which was once a disease curable with antibiotics, is gradually becoming resistant to many drugs. E. coli and Salmonella, which are foodborne bacteria, are also increasingly becoming drug resistant. So basically, the superbugs which are gradually becoming resistant to antibiotics is due to mutations occurring in their genes after becoming in contact with antibiotics. So in time, these resistant bacteria can pass on their genes to other bacteria through contact, forming a new antibiotic-resistant strain. Many bacteria become resistant to antibiotics by producing various beta-lactamases that are able to inactivate some forms of drugs. Once the beta-lactamase break the beta-lactam ring of the antibiotic, it destroys the drug. Changes in membrane permeability to antibiotics and enzyme degradation of antibiotics are also mechanisms leading to resistance. So basically, ways to overcome and block off the harmful bacteria is to make sure you wash your hands often with soapy water and use an alcohol-based hand sanitizer. If you are sick, make sure you go to the doctor and he has a clear understanding of your symptoms, and if antibiotics are needed, take the entire course as directed.
Herbal medicine have been used for thousands of years as antimicrobials and yet remain effective until today. According to the World Health Organization, 80% of the populations living in developing countries rely exclusively on herbal medicine. The most common mechanisms of antimicrobial actions through herbal medicines include phytochemical attack on the bacterial cell wall, inhibition of the enzymes generated by bacteria for deactivation of antibiotics. The research by Ben in 2008 confirmed that the two most effective herbal medicines with strong scientific evidence are ginkgo, where after conducting 8 randomized placebo-controlled double-blinded trials, it was found that ginkgo improves pain-free walking distance in patients with cortication, with a mean difference of 34 meters when compared to a placebo group, and 3% of the 212 subjects with Alzheimer's disease showed improvements in cognitive function. Garlic, which caused a 4 to 6% decrease in cholesterol, levels in all 13 trials conducted. Currently, extensive research on the African flower to treat symptoms associated with HIV have been conducted by government agencies with the assistance of the World Health Organization. It is highly recommended that herbal medicine be promoted to the general public more effectively and frequently, as well as doctors prescribing herbal medicine to patients instead of drugs. In most cases, common illnesses and diseases such as sore throat, sinus problems, and urinary tract infections can be effectively treated through maintaining a healthy diet, good hygiene, and undergoing exercise, as well as expert botanical medicine care by trained herbalists, thus preventing the misuse or overuse of medication in the long run.